focusing on commonly tested topics in the NCLEX. Detailed, high-yield, straight to the point, at the same time, precise and concise information about topics you need to know and questions. So let's take a ride and see what we have. It's our concepts. The first one is a client on levothyroxine present to the endocrine clinic for evaluation. Which of the following is concerned? We'll be working on test-taking skills. This video is designed for that, to answer questions. All of the answer questions, I'll go through the same protocol. First, I'll read it from the back. Which of the following is concerning? Then you underline the keyword. This is what's being asked. What is the case? A client on levothyroxine present to the endocrine clinic for evaluation. The buzzwords I've underlined. You look for the buzzword, usually to create a sentence, and then use that sentence to focus on what you pay attention to. So what is the problem? Keyword, on levothyroxine concerning. If you're on levothyroxine, I know you are hypothyroidism. That is the keyword here. You are hypothyroidism. So you have hypothyroid. If I give you levothyroxine, that means I give you T3 or T4. That's thyroid hormone. I should expect what? Your symptoms to get better or normal. So normal or get better, right? Patient with hypothyroidism, what do you see? All their symptoms is down, except their weight. Their weight is up, so they gain weight. So if you give them levothyroxine, their symptoms will improve towards more normal, and then they will lose weight, right? So if you're on levothyroxine and you're gaining weight, you tell me the medication is not working, right? So I'm worried about this. If you're on levothyroxine, I expect your heart rate to be normal or high. If it's high, I'm worried that I'm giving you too much medication. So levothyroxine should improve the individual heart rate, right? If they are hypothyroid, their heart rate will be low. This is normal. If you're on levothyroxine, your TSH, our target is to make it normal as much as possible. When you are hypothyroid, your TSH is very high. If I give you levothyroxine, it should come down, and this is normal. If you are hypothyroid, you're depressed. Your mood is down. If I give you levothyroxine, you're going to improve. So which one is concerning? The individual is gaining weight. That means the medication is not working. Key concept. So that's the right answer. So that's the explanation based on that. Number two, same things from the back. Look for the axe, the buzzword, the case, rewrite it, and then use it. Select and apply. That means there may be more than one answers here. But you don't have to pick all. Pick the one that you are 110% right. Which of the following additional, that means additional finding the nurse should anticipate? A nurse is caring for a client, G2P1, had 2 pregnancies, 1 baby. She's 30 weeks old. She has 1. Periorbital edema. She has headache, and she has blood vision. These are buzzwords I've underlined. More than 20 weeks, and I have periorbital edema, I have headache, and blood vision. Which of the following findings? Put it together. 30 weeks, periorbital edema is never normal in pregnancy lady. In addition to blood vision and headache, these are what we call end organ damage. So the patient has end organ damage. This is the diagnosis of preeclampsia. Okay? I'm worried about that. What do I expect? In preeclampsia, you see hypertension. As you see, proteinuria. What is proteinuria is? 24-hour urine protein should be greater than equal to 300. That's proteinuria. 250 is not enough, so this is not right. Greater than equal to 300. Or you should see greater or equal to +1 protein on urine dipstick. They should have epigastric pain. They may, and their reflexes is also high. So 2 is wrong, 3 is right, 4 is right, 5 is right, and 1 is right. So 1, 3, 4, 5. But you don't have to pick all of them. Pick those that you're confident and then move from there. Okay? So that is the right answer. Number 3, I said concept questions. If you want to master them, then watch the way I do them. Which of the following treatment by the client need further teaching? I need further teaching. So they're saying wrong thing. The client prescribed levothyroxine for new diagnosis of hypothyroidism. Is being discharged. That means I'm replacing their thyroid hormone. So you have to know the functions of levothyroxine and what does it do. This is a board favorite. This is commonly tested questions. Levothyroxine, you have to know. Levothyroxine is basically thyroid hormone. That's the way you take this medication. Full glass of water because it causes esophagitis. You go through the esophagus and irritate it. So it does not need further teaching. I will take the medication together with my multivitamins. Multivitamins contain iron, calcium, other chemicals that affect the absorption of levothyroxine. So this should be require further teaching. I will take the medication in the morning. Yeah, it's better to take it without food, full glass of water. If you have nausea, though, you can take it with food. It's fine. So this does not require further teaching. I will take the medication twice a day. This requires further teaching. It's usually a daily medication, once a day. Levothyroxine is once a day. So further teaching. I should be well in 3 months, and we can stop the medication. No, you're not going to be well. You can be well in 3 months, but we don't stop it. This is for life. You're taking this for life because you don't have thyroid hormone anymore. So that one is further teaching. 1 full glass of water? No. Multivitamins? Yes. Morning does not need further teaching. Twice a day, need further teaching. 3 months and I can get better, need further teaching. So what is the right answer? 3, 4, 5. No, 2, 4, 5 are the right answer. 3 is right. So 2, 4, 5 are your right answer. Number 4. This is also concept. If you know it, it's easy. Select or apply. Which of the following action need immediate intervention by the charge nurse? The nurse is caring for 5 clients who need blood transfusion. Which of the following action need immediate intervention? The best way to understand compatibility is to know that A, okay, it receive from everybody, universal receiver. And the O is the universal donor. Okay. The plus negative is irrelevant in blood transfusion. It's talking about resource. So it does not affect it that much. You are worried about the B antigen antibody. Now, the second thing you have to think about is when you transfusing somebody, when they're receiving the blood, is the receiver, okay? If you are the receiver, is your antigen that is in antibody that is in, you're going to use your antibody to attack the giver. So if this is A, this is the antigen. And then B is antibodies. Okay, antibody. So you cannot have the same antigen on your blood group. If you do, it's going to affect you. Okay, so that is the key. Okay, so you're looking for the individual should not have antibody against the antigen of the donor. You're attacking the donor. So look at the antigen of the donor, and if it matches the antibody of the recipient, then it's a problem. A can receive blood from minus O negative, right? It's a universal donor. Why? Because there is no antigen on O. O does not have antigen, it just have antibody. So A, okay, as what? B antibody. There's no A antigen for it to react. That's how you make. So does not need intervention. O positive receiving blood from O negative. Yeah, O to O is fine. Client with AB, look at it. AB, what kind of antibodies do they have? None. Because if I give you antibody A, it's going to react with the antigen A. If I give you antibody B, it's going to react with the antibody A. Therefore, AB does not have any antibody to react with the antigen of the donor. That's why it's a universal recipient. So client with what? AB can receive what? Blood from B because he has no antibody to B. So this is okay. Now, client with B receiving blood from what? AB. B, okay, he has antibody A that can attack the antigen of A. So this is wrong. B can receive blood from O people and B. So this one is a problem. AB, I said negative, don't worry about it. It's a universal recipient. So it does not matter what you have. It does not have antibody for A, so it should be fine. So B is the number 4 is the problem. You need immediate intervention. The rest are all good. This you have to watch this multiple times. You understand? It's the antibody of the recipient that attack the antigen. So there should be no antigen corresponding to the antibody of the recipient. Which of the following action indicate correct understanding of medication administration by the nurse? Is a select or apply. 8-month-old child is in peds clinic. The child has been tagging on the left ear, irritable, and the temperature of this. So we have a fever, and the kid has been tagging on the left ear, and is irritable, and then and then temperature of that. Which of the following action indicate correct understanding? Buzzword, tagging of the left ear, and being irritable, and I have temperature of this. This is consistent with what? Otitis media. This is middle ear infection. How do you do that? This is the individual, and this is the ear. This is the kid. If it's the kid, that's the way. Since you're going to put most of the time, you want to put the medication, antibiotic to go in so they can drop in by gravity. You put the affected side up. So affected side down is wrong. Pull the pinna is pulled back and down. The way to remember whether it go up or down is based on age. It's an 8-month-old, so it's going down. You pull it down. Next, don sterile gloves. There is no sterile gloves here. It's a clean gloves. You just wear clean gloves. Eardrops warm to room temperature. Yeah, you rub the eardrops bottle in your hand and palm so that you can warm it. So this is good. Or you can boil, put in a water that is boiling and to room temperature, basically. You instill the drops above the ear canal. That's the better English. And so 2, 4, and 5 are your right answer. Number 6. A nurse is assessing a G1 37 weeks client, 37 weeks pregnant. The nurse had a fetal outturn below the umbilicus and midline. Which of the following presentation the nurse should suspect? If this is the pelvis, this is the umbilicus, this is the pubic bone, the baby is there, right? If you want to hear the outturn, this one says right in the middle and it's below the umbilicus. It can be here below the umbilicus, but it's either on the right or left. If it's on the right or left, it's talking about cephalad and then a face presentation, but it's still below. The transverse one is the one that is below, but it's in the middle, transverse, because the baby like that. And the bridge, the baby is just sitting like that. And so the heart will be above it. So that is the way to think about it. And I can draw it individually and you can see. So if this is the pelvis and the umbilicus and the baby is laying like that, it's right in the middle. If this is the pelvis, umbilicus and baby is laying like that or laying like that, that is face and cephalic presentation. But if the baby is breech, it's like that is sitting like that. Umbilicus is here, will be above it. So this one, which of them is the transverse right in the middle? This is a commonly tested questions. Look at this question, be careful. It will be controversial depending on what they say, but it's a good content I want to show you in case you see it. Which of the following the nurse should anticipate? Like I said, these are recommendations. People have taken these tests, and these are the questions. So similar one with the concept. A nurse, you should be a nurse caring for a client prescribed Lisinopril for a new diagnosis of hypertension. The nurse observed periorbital edema. It's a buzzword. Periorbital edema, tongue swelling. So your eyes is getting puffy and your tongue is swelling. There's no pay attention. Urticaria, there's no bronchospasm or no pruritus. Which of the following the nurse should anticipate first? This is key. There is a temptation. So I give you Lisinopril. All of a sudden, you have facial edema, and then you have what? Tongue is swelling of the tongue. But you have no rash, you have no bronchospasm, you know itchy. This is angioedema, but there's two types of angioedema. There's the one that is due to bradykinin, okay? This is no bradykinin, which is allergic induced of angioedema. If it's allergic, you see urticaria, bronchospasm, and pruritus. If it's allergic, most of the time you have to give epinephrine, steroid, Benadryl, with the epinephrine being number one. But if it's bradykinin induced, which is classic with Lisinopril, because you know Lisinopril pathway related to bradykinin. That's why angiotensin 2 doesn't cause angioedema. There's no allergy. It's not an allergic reaction. It's due to bradykinin buildup. Therefore, you got to destroy bradykinin. And the best medication to do that is tranexamic acid. If they don't put this there, fresh frozen plasma is number 2. So this is number 2 for Lisinopril induced. This is number 1 for Lisinopril induced. So this is the one you pick, tranexamic acid. Caveat, if you taking the test and they said the patient is having airway, he has bronchospasm and everything, yeah, you go with urticaria. If you need to be into, you go with allergy related information. But if they don't give you that, yeah, you got to pick tranexamic acid or fresh frozen plasma. But if they give you these signs of allergy, having bronchospasm, I will give them epinephrine, treat them like they have allergic reaction. This is an advanced case. Like I said, this is what somebody saw. It's an allergy related Lisinopril and angioedema. They've been asked that way. The next is teaching a client with new prescription for Enoxaparin. That means Lovenox. The BMI is 20, so it's normal. You see, I'm going with the buzzword. Which of the following teaching indicate correct understanding? Therefore, if you injecting Lovenox, okay, in a patient with the BMI of 20, which is normal, you got to go, what, 45 degrees in subcutaneously. 90 degrees is if they are obese, or you can pinch, your pinch is greater than 2 centimeters. So this is wrong. It's never intramuscular, so I'm not reading the rest of it. It's never intramuscular test taking strategy, right? So the right answer is 45 degrees subcutaneously, and that's number 3. Next question. And next is caring for a client with a new prescription for lithium due to mania episode, right? The patient is in mania episode. Which of the following medication the nurse should question? I have to question during medication reconciliation. You know, like lithium is a bipolar, right? It's a bipolar. If you're on lithium, you're bipolar. That's why in the maniac episode, there's medication we use for these people in maniac and bipolar. You can give them second generation antipsychotic. It helps with the agitation. So this is good. You cannot give them bupropion because the side effect of this gives you a lot of energy. If I give you too much energy, you're already energetic. I said bipolar is a problem. So this is a wrong answer. Which of the following medication? The next question is that one. It's no good. I don't need to question. Lisinopril, ACE inhibitor, right? ACE inhibitor is not good for lithium. It makes lithium toxicity. Therefore, we have to question that. Chlorothalidone, this is hydrochlorothiazide derivative. It will make you have diuresis, dehydration, and make lithium toxic. We need to question that. Endomethacin, NSAID, you need to question that. All these questions is saying when you're you are bipolar, you should not take bupropion, you should not take ACE inhibitor, which will make lithium toxic, chlorothalidone, which will make lithium toxic, NSAID, which will make lithium toxic. You can give them valproic acid, which is also a mood stabilizer, and that can help also. So these are the things you don't need to question. 1 and 6 are fine, but whatever we need to question is 2, 3, 4, and 5. It's all concept, and you have to know this stuff. And the last one is diagnosis. Which of the following the nurse should suspect? Client present to the emergency room. Pay attention. Password: acute, sharp, excruciating, frank pain, radiating to the groin, associated with what? Nausea and vomit. There is no fever, but it's slightly tacky because I'm having pain. Which of the following is suspected? The nurse should suspect. This is the umbilicus, this is the kidney, and this is your bladder. You have frank pain going here. It's going to the groin, and it's sharp, excruciating. It's not cystitis. Cystitis will give you pain just suprapubic. That's over here on top of the bladder. Pyelonephritis is also frank, but it goes to the umbilicus. It doesn't go to the groin. You may see fever with that. So there's no fever, therefore I cancel this. Kidney stone, yeah, from the frank to the groin. Urethritis, that means they're having discharge, inflammation of the urethra. They won't have a frank pain. They're usually here in the penile area. And so this is test taking strategies based on content. And as you can see, the right diagnosis is what? Nephrolithiasis, kidney stone. I did not give you kidney stone. I wrote nephrolithiasis, but this is the same thing as kidney stone. First question, second video. Take care of yourself. Subscribe to Adapt NCLEX for more like this. All the best of luck. Bye.